Bismillahirrahmanirrahim. Today our topic of discussion is coronary artery diseases. To know about coronary artery diseases, first we have to know what are coronary arteries. Coronary arteries are arteries which supply to the heart. There are mainly two coronary arteries, right coronary artery and left coronary artery. Left coronary artery then divides into two, circumflex artery and left anterior descending artery, and this left anterior descending artery is also called widow artery. Coronary artery diseases. Coronary artery diseases causes impaired blood flow in the arteries that supply blood to the heart. They are also called coronary heart diseases. Coronary artery is the most common form of heart diseases and it is the leading cause of death. Causes of coronary arteries. Atherosclerosis. The most common cause of coronary arteries diseases is atherosclerosis. Atherosclerosis is the cholesterol plaque formation in the coronary arteries. Thrombosis is also one of the cause of coronary artery diseases, and damage or blockage to coronary artery. Symptoms of coronary arteries are angina. Angina means chest pain, heaviness, tightness, burning, squeezing, etc. Risk factors of coronary arteries. High blood pressure, high blood cholesterol level, tobacco smoking, insulin resistance or hyperglycemia or diabetes mellitus, obesity, inactivity, unhealthy eating habits, obstructive sleep apnea. Sleep apnea means that it is disorder in which breathing repeatedly stops and starts. Emotional stress, excessive alcohol consumption, and history of preeclampsia during pregnancy. It is a serious blood pressure condition that develops during pregnancy. And diagnostic investigation of coronary artery diseases are ECG is one of the most common diagnostic investigation, electrocardiogram and echocardiogram. It is the imaging test uses ultrasound waves to create a picture of heart. The result of the test revealed whether certain things in your heart are functioning properly or not. Stress test. This particular test measures the stress on your heart during physical activity and while at rest. The test monitors your heart electrical activity while you walk on a treadmill or ride a stationary bike. And angiography. During this procedure, doctor injects a special dye in coronary arteries through a catheter inserted through an artery in groin or forearm region. And the dye helps enhance the radiographic image of coronary arteries to identify any blockages. And heart CT scan. Lipid. The atherosclerosis is the most common cause of coronary artery diseases, and atherosclerosis is caused by the high lipid level. So there should be lipid lowering drugs for controlling lipid level in the body. So to know about lipid lowering drugs, first we must know about lipid metabolism. So here we will discuss first about liver metabolism. What is lipid metabolism? Here, glucose and cholesterol in liver combines to form acetyl coenzyme A, and then acetyl coenzyme A is converted into HMG coenzyme A, and after this is converted by HMG coenzyme A reductase enzyme to mevalonate, and this step is the rate limiting step of lipid metabolism. If here we limit this step by giving drugs like statin, then no more cholesterol formation will take place, or no more lipid metabolism will take place, and thus it will lowers blood lipid level. After this, myelinate is converted into cholesterol esters and fatty acid. Here, acetyl coenzyme is converted to fatty acid and to glycerol 3 phosphate to triglycerides, and these both combines to form very low density lipoprotein, and then it is converted into IDL and IDL into LDL, and this process takes place in the blood vessel. And when LDL is formed, it is transported to cell, and when an excessive LDL is transported back to liver in the form of HDL. But when there is excessive LDL in the blood vessel, it is oxidized by the oxygen, and it is converted into oxidized LDL, and it forms cholesterol plaques, and this causes atherosclerosis. So lipid lowering drugs, to lower lipid to lower lipid level in the body, it's obvious to lower its absorption in the gut. So there are drugs which lower its absorption in the drug. So first we will discuss what are the drugs which lower the lipid level. These are statin, fibrates, cholestyramine, niacin, ezetimibe. Ezetimibe, previously I said that it's logical to lower lipid level to decrease its absorption from gut. So ezetimibe decreases or inhibits absorption of cholesterol from gut, which increases uptake of LDL into the cell, and it will the blood LDL will transport it into the cell, and no more cholesterol is absorbed. So ultimately, blood lipid level will decrease. So low blood lipid level of the body will be lowered. Then the next drug is cholestyramine. Cholestyramine, as you know that when bile is transported to to the gut, to the intestine, and here it helps in the emulsification of fats, but it is transported back to the liver. When this transport to the liver is inhibited, then no more there will be no more bile in the liver and in the gallbladder. So liver will sense it, and it will form more formation of bile, and this, and in bile there are cholesterol, so cholesterols will be used up by the liver, and thus this will lower lipid level of the body indirectly. So it inhibits enterohepatic circulation and by entrapping bile in the stool. So, if inhibit bile transport to the liver, liver will form more bile from cholesterol, and thus lower lipid from in the body. Statin, as I previously said, that it inhibits rate limiting step of cholesterol metabolism, that is HMG coenzyme A reductase. So, liver will take more cholesterol from blood, and this will lower cholesterol level in the body. Fibrates is another class of drugs used in lipid lowering drugs. Actually, fibrates stimulate lipoprotein lipase and converts more VLDL to IDL, so reduces liver triglyceride and cholesterol and liver's lipid level in the liver, so ultimately decreases lipid level in the body. Niacin in low doses it is vitamin B3, and in high doses it acts as anti-lipidemic drug. It inhibits formation of VLDL by inhibiting cholesterol conversion to VLDL, which increases good cholesterol in the liver, that is HDL. So now we will discuss here that we inhibit which step in lipid lowering drugs. Here, statin inhibits this step, the HMG coenzyme A reductase, and inhibits the conversion of mevalonate, and this lowers the lipid level in the body. Second class of drugs used in lipid lowering is niacin, and niacin inhibits conversion of cholesterol esters into VLDL, which will increases actually it inhibits formation of VLDL by inhibiting cholesterol conversion to VLDL, which will increase good cholesterol. This will be converted into good cholesterol, and this is useful for the body. And another class of drug which is called fibrates, it inhibits this step, and when this step is inhibited, it will not form LDL, which is the bad cholesterol in the body. So it will lower bad cholesterol, or bad lipid or bad lipoprotein in the body.